Hello and welcome to Inside Exercise. I'm Emeritus Professor Glenn McConell from Victoria University in Australia. The idea behind Inside Exercise is to bring to you the absolute who's who of exercise research, so exercise physiology, exercise metabolism, and exercise and health. And what I'm really wanting is for you to get your exercise information from the research experts rather than from influencers. And today I bring to you a very interesting mix of people that are just astounding, really. So we have an incredible researcher in Professor Mark Haykowsky, but we also have remarkable heart transplant recipients. So Professor Mark Haykowsky is from the University of Alberta in Edmonton, Canada, and he has done remarkable studies for many years on heart transplant recipients. He's exercised them, he's looked at their fitness levels, etc. And he has been closely associated with these two remarkable heart transplant recipients, Elmar Sprink from near Cologne in Germany, and Dwight Kroening from Alberta in Canada, which is where Mark is from. They have both done Ironman triathlons. Dwight, who is 37 and a half years post-transplant, is the first ever heart transplant recipient to finish an Ironman triathlon. And then Elmar Sprink, who is 12 years post-transplant, has also undertaken Ironman triathlons, but also more than that. So incredible multi-stage mountain bike races, etc. Both of these guys have had VO2 maxes in the high 50s, and both of them have probably at various times been the fittest heart transplant recipients in the world. As we discussed, they are not your average heart transplant recipient. The average heart transplant recipient ends up close to normal for a non-transplant recipient, but then has a much shortened life expectancy. But here you've got these two that are absolute trailblazers in the area. So as Mark points out, we don't really know what the prognosis is going forward because, for example, Dwight has lived 37 years post-transplant, which if you survive the first year, the average is about 12 or 13 years. So really quite remarkable. There's a lot more to these guys than just being heart transplant recipients. So they talked a lot about relationships, about the importance of goal setting in their lives, important things that all of us need to consider and we can all get a lot out of. What became very clear during the discussion is just the importance of exercise, not just for heart transplant recipients, but for everybody, of course. And these guys are really, really motivated people. I really enjoyed the chat. I learned a lot. I found it very motivating. I think you will too. So stick around. If you can do me a favor and also spread the word about Inside Exercise, please like, subscribe, comment, etc., because then the algorithm will be more likely to suggest Inside Exercise to people. You also see in the notes that there are timestamps. So even though you'll get a lot more out of the podcast if you listen to the whole thing, you can jump around a little bit if you like by looking at the timestamps. You can click on the times. If you're on YouTube, it will move to that section. And the other platforms, you can just look at the times and then move manually to that. Okay, so enjoy the chat. Hi, Mark, Elmar, and Dwight. Welcome to Inside Exercise. How are you guys doing?
Very well. Thanks, Glenn, for the invitation. Excited to be here.
So we've got Mark, who's the exercise physiology PhD professor. You're in Edmonton, Alberta, correct?
Yeah, that's right. Edmonton. We're finally getting some nice warm weather tomorrow. So
okay, and that's where Dwight is as well. So hi, Dwight. How are you?
Oh, hello. Yeah, that's correct. We've been in a bit of a freeze here, but it's supposed to be melting next week.
Yes, and then we've got poor old Elmar. Well, actually, I'm not saying he's old, but he's a bit sad because it's 10:30 or something at night in Cologne, Germany. Is that right?
Yeah, 10:30 is correct, but I'm not in Cologne. I'm close to. It's like 1.5 hours from Cologne, but here it's like 5-6 degrees. But I'm leaving for like a training camp in Spain, so it will be 20 degrees warmer on Sunday, definitely.
Oh, golly. Okay. All right. So we've got a lot to get through here, and it's the first time usually it's just one person I'm interviewing, and once I've had two people, but here we got three, so it's going to be a bit of a jumping around. But what I was thinking we'd do is talk about, we've got these exceptional athletes in anyone's, language, let alone the fact they've had a heart transplant. It's just remarkable. And Mark has worked with these guys, an exercise physiologist who's done a whole bunch of research with heart transplant patients. So what I thought we'd do is go through initially and just talk about, why do people have heart transplants? What does the heart even do? What goes wrong in people that have a heart transplant? What's involved in having a heart transplant? Where do you get the heart from? The recovery, and then we'll get to the actual fact that these guys have become, absolute athletes, and how they got there and things like that. So I think, maybe it's best if we talk with Mark about some of the science of it, and then obviously Dwight and Elmar will chime in here and there, but we really want to know their story. But I think it's good just to set the scene a bit. Yeah. So I guess even Mark, how did you even get into this sort of research? You're an exercise physiologist, but it's a very interesting specialty you've got.
Yeah, it's been a lot of fun. I've done a lot of sport when I was younger, and a lot of powerlifting, and actually set a junior world record in the squat back in 1988.
Oh.
So it was my love for sport.
Wow.
Actually, I think my undergraduate degree was in powerlifting.
Oh.
So I really got interested in the heart just through, people would say, "Oh, don't do a breath hold," and I was like, "Well, we always did a breath hold when I lifted weights. That's the craziest thing I've ever heard." So we started doing studies on the hearts of athletes for my graduate training and working with elderly individuals, and then I also had training in the emergency room. I'm actually trained also as a registered nurse in trauma emergency. And for my graduate work, I met my mentor, and he's like, "Well, you've got a background in exercise physiology and nursing. We're starting a study in individuals who have heart failure." And this was back in 1990 when we weren't even exercising heart failure patients. Everyone was worried that if you exercise a heart failure patient whose heart is big and dilated, you're going to put them into heart failure and they're going to get worse and they're going to die. But in fact, we found they do quite well, just like everybody else. You just have to, base your training on what they can do. And then I was very interested in the transplanted heart because 20 years ago, although now we do a lot of left ventricular assist and mechanical hearts, we actually did the most heart transplants in Canada in our center. On a good year, we would do 74 heart transplants. So I was very interested in the heart physiology and the unique physiology of the transplanted heart. So you asked me before, what does a heart do? And of course, you've had some great speakers with a great colleague of mine, Ben Levine, and world-renowned sport cardiologist who had just great descriptions of stiff hearts. But really, the heart just does three things. It contracts, it relaxes, and it fills. And it just does that throughout your whole lifespan. And unfortunately, our heart failure patients over time, maybe due to underlying heart disease, having a heart attack, the heart can dilate and not fill as well or contract with blood as well. Or for reasons we don't know, idiopathic dilated cardiomyopathy, the heart just actually fails. But as the end result for our heart transplant recipients, obviously they're going on medical therapy and they do often very well and for the most part. But some of our patients, when they exhaust all their medical therapy, they may need a device to help their heart pump. And ultimately, the end stage where there's just no other therapy, the last stage really is heart transplantation. So it really is sort of the last resort. But unfortunately, because we don't have a lot of donors, there's more people that need hearts than unfortunately can receive a transplant. And although you were going to just maybe not talk about the history, it is quite a unique history. So I'll just say one thing, because the first heart transplant was performed in Groote Schuur Hospital in Cape Town in South Africa by Barnard. The operation started on December 2nd and went into the 3rd. And the first individual survived 18 days. Then Barnard did the second transplant, and that individual actually lived for about a year and a half. The trouble with the early transplant is that the heart obviously is going to be foreign to the body and it can reject. So then with the advent of these immunosuppressive drugs, people have now been living very long lives. So if you, the average survivorship post-transplant is about 11 years, but if you survive the first year when the highest mortality rate is, the average survivorship is about 13. So relative to as you hear with Dwight and Elmar, who are basically, in certain cases, days to a month from death, now they're over 10 and almost 30 to 40 years post-transplant is phenomenal. So relative to the very short span that you have when you're on the list, this is obviously a very important therapeutic medical intervention.
Absolutely. So you mentioned things that can go wrong with the heart that result in a heart transplant. But I guess in the situation where someone has a heart transplant, do they need to be young? So these, obviously Dwight and Elmar were relatively young. I guess because of the strain that it puts on, or just the lack of availability of the hearts, or how does that work?
So this is a really great question, Glenn, because there's a couple answers to that. If you look at the International Society of Heart and Lung database, and they have the largest database of heart transplant centers in the world. So roughly the average age of the donor, and I'll use this term allograft, that's just the donor heart, is around 35, maybe 45, but the age of the recipient is somewhere around 55 to 65. So you, in essence, are putting a younger heart in an older body. And what's really unique about the transplanted allograft is you'd think that, okay, if I put a younger heart in an older body, it's going to just pump just like this younger heart. But in fact, it pumps very, very well. But a few things happen. First off, remember I said the heart does three things. It contracts and relaxes and it fills. But the heart also has nerves. So we got our gas nerve, right, to speed up your heart. And then we've got your brake nerve, the parasympathetic. Well, in the operation, those nerves are cut. So the allograft is actually denervated, meaning the normal resting heart rate is 60 to 100. But we know what the true intrinsic heart rate of a human is from heart transplant, because it's actually about 110 beats per minute when you have pure sympathetic and parasympathetic reinnervation. What's really unique about both Elmar and Dwight is their nerves to their heart, the gas sympathetic nerve, has grown back physiologically. And it's something we can talk about, but we don't know really why. But Elmar is also very unique because I've never seen it before and it's not in the literature, but his parasympathetic nerve seems to be grown back as well because his resting heart rate's 42 or 43.
Wow.
So it's quite phenomenal. So the one thing post-transplant, the fitness will go up, but it's still 40 to 50% lower the VO2 than age-matched individuals. That's because the allograft is denervated. But it also, remember Ben Levine talked about the stiffness of the heart? The transplanted heart is actually stiffer in the recipient's body than it would have been in their own body. And that may be related to the ischemic time of the operation. It could be related to rejection. But likely what it is that when you have heart failure and the heart doesn't pump or fill with blood very well, over time, you also have vascular failure and skeletal muscle failure. And we transplant the heart, but you're transplanting that heart still with a very impaired vasculature.
All right.
Muscles, as your prior speakers have talked about, are still very anaerobic-like.
Oh, okay. All right. There's a lot of information there. I just want to make sure we take people with us. Okay. So, So you're saying so people are probably familiar, the resting heart rate's usually, we say in the textbook 70 beats per minute or so.
Yeah.
And as you say, you've got nerves, so the sympathetic nervous system, so the fight or flight, the adrenaline type thing, is speeding up the heart.
Correct.
And then the parasympathetic is slowing down the heart. And you're saying that normally the reason we have 70 beats per minute is because the parasympathetic, which is putting a brake on it, is slowing it down from what would have been, say, 110. Yeah?
Correct.
Slowing it down to 70. So you're saying when you had this operation, which somehow I thought they would try and put the nerves back together, but obviously no. So you can't.
No.
Okay. So they've had to cut the nerves to take the heart out and then put the new heart in. So you don't have that. So their heart rate's 110 or so.
The resting,
right? Yeah. And at resting. And if you're also saying, because part of the thing you said, it contracts, it relaxes, and it fills. During the resting period, you need the heart to fill. And I guess they're not getting proper filling. And you're saying it's not as compliant, it's stiffer. So you're probably not getting as much filling either. So I guess where you're heading, and you kind of touched on, is that their cardiac output, their heart's function, even though they've got a nice new heart, is not as good as the person whose heart, the person who died, their heart was functioning better than.
Yes. Yeah.
Okay.
And for all that is correct. Now, way better than the failing heart. And I'm not suggesting that heart is not functioning well. It's functioning very well, but paradoxically, relative to what, let's say, me, if I'm the donor, it is stiffer. And it doesn't pump out as much blood with each beat as well. So when we compare the cardiac outputs of denervated heart transplant recipients, their cardiac output is markedly lower.
Right. Okay. And what I want to get to later, and you touched on, because there's quite a lot of stuff there, is the fact that, and this is something I remember reading, because my grandmother actually had heart failure, and it was 30 years ago or something. And I actually saw, maybe it may have even been some of your papers, that exercise is good for heart, but everyone's like, oh no, and I think it was too long, and she was too old, she was 80, and she had emphysema as well, and so it's just like, leave her alone. But I had seen that sort of information, and what was interesting, I had seen what you touched on then, that if you take the heart out and you put it in the new in the donor, in the recipient, they've still got those peripheral problems. So we'll maybe get to that. But you said their hearts, their aerobic functioning of the muscle, etc., not the heart. Okay, so that's very interesting. Now, this is the thing you touched on there. So you're saying you get innervation again. So when you cut it, you've had de-innervation, so no nerves going the heart. And you're saying both in Dwight and Elmar, they had the sympathetic attached, which means they can speed it up, which means they can get their cardiac output up. But now, was it in Dwight, I think you said? Yes?
Elmar, yeah.
Sorry, Elmar, he's actually, for the first time you know of, had the parasympathetic nerves, so the vagus, attached to slow the heart as well. And he has a resting heart rate of 42, which a lot of people will be envious of.
Yeah. Now, full disclosure, we've never done any studies. When I talk about reinnervation, I'm talking about physiologic reinnervation, because what happens for the donor allograft that's denervated, how you know they're denervated is when you and I start to exercise, the brake nerve relaxes, so your heart rate increases, and then around 100, 120 beats per minute, the sympathetic gas nerve kicks in.
Yes.
So the body's phenomenal because it always has checks and balances. So there's a third check. Right, we can also have adrenaline that's secreted from on top of the kidneys. So our transplant recipients can still increase their heart rate when they exercise, but it takes about 8 to 10 minutes for that circulating catecholamines on top of the kidneys to kick in. So their heart rate will increase in about 8 to 10 minutes. And when you stop exercising, you and I will have a rapid decrease in heart rate. But our transplant recipients that are denervated, about 5 to 10 minutes, their heart rate is now slowly coming back down. So how do we know that they're physiologically innervated? Is Marcus Schwaber at Technical University in Munich did some elegant studies with PET scanning and MRI, and they use a false neurotransmitter. And what they found is that, and this is kind of funny, when I talked to Marcus this last year, they actually used the heart transplants as a control because they were told that they're denervated.
They never.
Paradoxically, they found a quarter of them actually were reinnervated. So reinnervation does occur. It doesn't occur in everybody, but when it does occur, it's what we call heterogeneous. It's kind of patchy. It's not the same in everyone. And it seems to follow one of our main arteries in our heart called the left anterior descending artery. So the front of your heart, the main artery. So it does occur. It often occurs in individuals who have had the operation is more brief, they're not rejecting, or a younger donor. But so Elmar and Dwight aren't unique in that they're not the first that they've reported reinnervation. However, their maximal heart rates, Glenn, if we put you on the treadmill and them, I wouldn't know whose heart rate we're looking at. There's both go rapidly go up to as high as 180, and they both rapidly come down.
Wow. Okay. Now I'm starting to feel a bit bad. These guys aren't getting to have a chat. So I'm very interested in what it was like for you. I can't even imagine. I guess I'm a bit of a wimp. I've had 33 muscle biopsies, but when it comes to my heart, I'm just like, let's not even think about that. So I wonder if you mind maybe talking a bit about your own past. I obviously it'd be very different. And then what it was like for you leading up to that situation. I don't know who wants to go first, or I guess Dwight, was Dwight your first heart transplant patient?
Yeah, so we conducted a study 20 years ago, and I had heard that there was this really fit transplant recipient, and I went to clinic one day and he wasn't there, and so we ended up connecting, and I talked to him. I said, I heard you're pretty fit. He goes, yeah. We measured his VO2 on the treadmill. It was nearly 50, and I couldn't believe it. So I thought the metabolic cart was wrong because we're used to seeing 13, 15. So we did a supramaximal test. And for people who aren't familiar, what we do is after we do a max test, if we want to validate it, so we gave him a bit of a break, and then we put literally warmed him up for about 2 minutes, went right back to
smashed it straight up.
182, and it was, and I was like, oh my God,
Wow.
I've never seen anyone this fit. So that's my first introduction to Dwight, who can tell you a little bit about his story because it's remarkable.
Yeah, Dwight. So I'm interested in were you a sporty person initially, and then what went wrong, and
Yeah, that's going a ways back, back to 1986 and prior. So I was 26 at the time, and I loved athletics. I loved sports. I was a phys ed major in university in the education field, and so that was my life. But I wouldn't call myself a high intensity trained athlete. I wasn't in a particular sport I just like the broad range of athletics and activity.
This is at what age, sorry?
Pardon me?
This is up until what age?
This was during university and then up to the age of 26.
Okay. Yep.
Okay. Because I was 26 when I had the transplant in 1986.
Wow.
And so then going back to what Mark was saying earlier about the transplant program here at the University of Alberta, doing 74 transplants a year, they started the program in 86.
Okay.
And at the time I was in Phoenix when I got to a point where the heart was diagnosed as failing considerably. And at that time, I was told when they were looking at my candidacy for transplant, I was told that as of 6 months earlier, transplantation was considered experimental in the States, which probably explains why we were 5 years into the program at the Tucson Medical Center, and I was the 100th transplant. So it took them 5 years to do 100 transplants. And I think that was because it was experimental, not clinical. And when I was diagnosed, they had just determined prior that it was clinical. And so my insurance, or the insurance of my wife through the company she was working for, covered the entire cost.
Wow. Okay.
Yeah.
Because these are big, we'll get to this, but I'm assuming these are massive operations.
Yeah. But back to your question about my fitness levels and that sort of thing, even up to the point of transplantation, I was still attempting to be as active as possible, which they didn't support, they being the transplant unit there. They did not like me doing the activities that I was doing because they felt the heart could fail at any point completely.
And what was what happened? Did you have a heart attack, or like what was the initial, how did you even know you had a problem with the heart initially?
Yeah, it was called idiopathic cardiomyopathy.
Okay.
That just means that I had an enlarged heart with cause unknown.
Right, that's the
And
idiopathic
I believe that 3 years earlier I had contracted bronchitis. And from that point on, I noticed in retrospect, my physical fitness was declining. And I chose not to accept that fact and just continue to work and train as hard as I could to overcome that until the heart got to such a size that it was only beating and eventually at about 8% functionality.
8%. So here we're talking about, I guess, Mark, ejection fraction.
Yeah.
So what percent of
the amount of blood you pump out relative to the amount of blood that comes back to your heart. Normal's 50 to 60, and his was around 8.
8%.
Yeah.
Okay.
So if you equate that to functionality, I couldn't walk a flight of stairs. I couldn't eat sitting up. I was exhausted lifting the board. Couldn't brush my teeth. I was exhausted. I'd have to sit down to comb my hair. And that's the point at which it got.
Wow. Okay. And then what's it like to be told, well, I guess, so is it like you're either going to die or you're going to have a heart transplant, but then you don't know if there's going to be a heart transplant at time. You don't know if someone's going to be available. I mean, it must be horrible because it means someone else has to die, right? For you to get a heart.
Yeah. Remember first that this was back in 1986.
Yeah.
We did not even know there was an option. We had never heard of heart transplantation. And so when I was diagnosed, I had 2 cardiologists in Phoenix. And they told me, basically, you have a very limited time to live. We will stabilize you and you go home and make preparations. That was it.
Oh,
And
okay.
it wasn't until 3 days later that they said there is one possible alternative. And they were very hesitant in even communicating that. And that was that the University of Tucson Medical Center had a transplant team. So they suggested if I wanted to, I could go down and talk to them.
Okay. And the thing I remember, we talked about the age earlier. I was actually also thinking about the age of the recipient. So is it more likely, because Mark was talking about you tend to have a younger person's heart going into an older person. Is it more likely if your heart's failing and you're younger? Well, okay, 1986, all bets are off, I guess. It's just, but I guess nowadays, is it more likely they give it to a young, healthy person because they've got more years to live?
They have a United UNOS, and it really goes on this list who is the sickest. And obviously there's certain criteria for matching, but it's really, on this list, the sickest people. But there are criteria for matching for sure that must be met. But they try to match you, donor heart size as best. But again, it's because time is money. You have to be, sometimes it's not the perfect match, but yes, the sickest person is going to be on the top of the list.
Can I just ask again? Okay, so I guess what about if you've got two people equally sick and one's younger or one's older? Does it get, I don't know, it probably gets a bit political or something as well. Or who knows?
Now, Glenn, just one last thing you've probably never ever thought about, because when we present different rounds, this is the only model where you also can have, and think about it, a male heart in a male body, a female heart and a female body, but you could also have a female allograft in a male body or the reverse. So it's now all your podcasts you've had, we're putting it all in one, because now you have female allograft could be in a male body. So these are really interesting things that when you start talking about physiology,
estrogen receptors and things like that. Okay, that's interesting. All right. So just with Dwight, so I'm interested. So how was it for you? So how long is it? I guess things like how long of the operation, maybe it's different now, but in 1986, well, actually, sorry. So you were thinking you had days to live, and then there was this chance you could go, I think, to Tucson, is that what you said?
Yes.
And then what, you get a phone call, someone's been in a car accident or something. How did it happen?
Yeah. I mean, there's so many side points to all of this. Talk about the politics, talk about the fact that they were looking for their 100th transplant. It's like a perfect storm for me. So I showed up at just the right time, miraculously. And I think they were salivating. They really wanted me to be accepted into the program. And so we determined we would do the workup with payment, of course. And so going in, I was very, very skeptical because, like I said, I'd never heard about transplantation before, and I wanted some guarantees. And I tell Mark this sometimes too, that you got to promise me this if we're going to do this. So I said, you got to promise me that if I go through this, I'm going to be able to do everything that I used to do in terms of fitness, athletics, lifestyle. And they said, you can't promise you that, but we can show you people who have successfully been transplanted and living an active life. So I figured, okay, one guy who was doing sprint triathlons at the time after his transplant, I thought if he can do it, I think I can do it.
Wow.
Agreed to the program. And it was after they did the assessment and the workup, they gave me 2 months to live. And this was June 6th, 1986. And I was transplanted on August 4th, 1986, 2 days short of 2 months. So I was a universal recipient, and I was healthy except for the heart. I was young, and they found a donor. A donor that came on the scene was 23 years old. And I received the call at 1 a.m. on August the 4th. And they said, the donor is local, so you don't have to rush, but you can drive down to Tucson. You need to leave right away. Come down to Tucson and we'll be waiting for you. And so because the donor was local, they were able to extract and bring the heart and then transplant them.
I didn't realize when you said hundredth, I didn't realize hundredth on the dot, 103rd or 99th or something.
Yeah.
But you're saying it was a big deal. So it's quite amazing, yeah. So that it was a big milestone as well. So I wonder if I can ask, does the person have to be like alive and on life support? I assume they had life support back in 1986. Does the person have to be sort of still alive or on life support to do the heart, or can you actually take the heart and put it on ice for an hour or something?
They have to be clinically dead, obviously,
Mhm.
and identified as such. And I think Mark can maybe be more technical in this. But I was told that you need 3 hours from extraction to putting back in. And so
Okay.
there's that time limit. So that if it's not local, then they have to either rush you to where the heart is and where there's a transplant team, or they have to get the heart to you within that period of time.
Okay. So I wonder if we could maybe I'll talk a bit more technical bits and pieces with Mark, and then maybe we'll go to Alma's story about how, and then maybe we'll get back later, like what happened after the transplant, how did you get to where you're at, etc. Does that make sense? So yeah, Mark, is there a different prognosis if it's straight from the person who's still on life support, for example, into the recipient, or versus an hour, 2 hours, 3 hours, or is it pretty much the same?
I mean, the longer what they call the ischemic time, the higher the mortality rate or maybe rejection. But we could potentially get hearts from Edmonton from 3-4 hours away, travel. But yes, they want to really limit the ischemic time as much as possible to, the time that heart is explanted and then implanted in the recipient's body, because it's much more favorable.
Okay. So just to clarify for people, so ischemia means lack of blood flow. So when you've got no blood flow, therefore no oxygen going through the heart itself,
exactly.
it's going to
So
start
they'll
to
put
die.
the heart in a cold Pelagia solution and transport it, but that would be considered ischemic time that whole time. So obviously you want to minimize that time, and including the operating time.
Okay, and just another sort of technical thing. So Dwight mentioned the universal donor. Do you want to just explain what that means? Because I guess, we all tend to know about if you're having a blood donation, you've got your different blood types and things. Is that what needs to be considered there when you talk about a good match?
They're just matching as far as, you don't want to reject that organ, right? So they'll have to match the recipient body with the donor heart, because that's where our transplant recipients, like both Dwight and Elmar, will be on immunosuppressive therapy for their whole life. Because the minute you don't, that your body will sense that organ, the allograft, as being foreign and reject it.
Yes.
So obviously there's a whole workup with respect to blood matching, and that has to be met to ensure that you don't have rejection of that organ.
So is it only blood matching, or is there other?
That's sort of the area that I focus on. So I'm not sure what the full workup is now, but definitely a blood group matching for sure. And I'm not sure now, as it's evolved, what specifics they are currently doing. But yes, that's the main thing is rejection is in the first year post-transplant is the leading cause of death.
Is it? Okay. Yeah, because I was wondering about that. So what makes, well, we'll get to this later maybe, but what makes the likelihood of someone dying in the first, because you said if you get through the first year, then on average it's about 12.
The leading cause of mortality in the first year is rejection. But interestingly enough, in the long term, there's something that's called vasculopathy. So probably not you, Glenn, because you're fit, but someone like me who's not an aerobic athlete, you get coronary artery disease, and sort of you get these plaques in certain areas of your artery. In our transplant recipients, vasculopathy is like long-term chronic rejection. You get plaques all the way down the artery. So there's not a lot, you can't put a stent in there because it's all the way down the artery. That's another form of sort of chronic rejection. So early on, it's more acute, but in longer term, what is a leading cause is more this term called vasculopathy, which is sort of chronic rejection and sort of these plaque buildup all the way through the artery. That's why it's critical to really, maintain your activity and be as fit as possible, right?
Which is actually the same as people that don't have a heart transplant, but they've got the complication. And I'm assuming the anti-rejection drugs have side effects and things like that as well.
Exactly. Yep.
Okay. All right. So yeah, I'm very interested in Elmar. So thanks for that, Dwight. And as I said, we'll get back later. Like, okay, so now you've got the heart. Then what was it like going forward? But maybe we can get to that point with Elmar and his story, which I know is different, but it ends up amazing as well.
Yeah, my is different. So I didn't get a phone call to come to get somewhere to receive a heart. I think I have to go back to July or to 2010. I was into sport a lot. Like a child, I did everything like track and field and basketball. And then in Germany, you end up in soccer with a dream maybe to make it to Bundesliga or whatever. So, yeah. But with 15, 16, I saw I'm not making it. So I just went to school and then studied and stuff. But I always loved running. So end my soccer whatever career. So with the beginning of 30 and I get some back problems. So I went to the orthopedic doctor and he said I should go for a swim. So I started swimming a bit and then I end up in triathlon. I started triathlon in 2004 and in 2005 I did my first Ironman. And so did every year Ironman. Yeah, I traveled a lot, Arizona or Florida or Austria. And in 2010, I changed the job internally. I was working lots of hours, and then I saw that in the winter series, you always run like 10K, 15K, half marathon. So actually, I saw that I was like my times were like 36 minutes on a 10K, and suddenly it was only 38, 39 minutes. So
okay.
It was like in April, and I'm allergic against a lot of trees here in Germany. So I had problems with breathing. So I saw my cardiologist, and I told him I'm running the 10K only in 39 minutes. And he said that's a luxury problem because he can't make it under 1 hour.
Sorry, can I interject? I'm just wondering, so you're a fit athlete, and you said I saw my cardiologist. So most people don't have a cardiologist.
Oh, yeah.
And with the breathing, why wasn't it asthma? Why weren't you thinking asthma or something? I thought,
yeah. So I saw like a cardiologist to do a test because I was doing Ironman Austria, and I always did a threshold test or whatever. So I went to see my cardiologist. I told him that I feel a bit of breathing problems, and he said, okay, maybe it's kind of sport asthma. What the France drivers. So I got a asthma spray. He did the threshold test. I had the VO2 max, and the ECG looked totally normal. And then it started getting worse. So I always had these breathing problems, and I started triathlon season. So I had 1 or 2 DNF in triathlon, and then I saw a doctor again, and they said, okay, now everything is fine. You can do the Ironman. I did Ironman Austria, and during the run, so I just thought I had like a used day. Yeah? My heart rate was higher, and I wanted to. You always have like a prediction, like you want to swim like 1 hour, blah blah blah, like you want to 5 hour, whatever, and then at the half marathon, I dropped off this Ironman race. I went back, and I was at home, and I was a bit disappointed because I had a DNF. So I started cycling again, and on the day, it was the 10th of July, I was actually on my sofa watching the Tour de France, and I had a cardiac arrest on my sofa. That's how it started. And there are people around, and our neighbor is a doctor, and he had a knee surgery. So he was by himself. He had a knee surgery, so he was at home. And he gave me CPR. So that was my luck that people were around, and doctor was around. And I woke up in the hospital, and then they did all this test, like they did a heart catheter. So I had no no heart attack, no stroke. They did a lot of tests, and then in the end, they sent me home. Yeah, and then I went in our capital. I went to Berlin, and they did a lot of tests as well. And I did a test which with some, I don't know what's exactly, with some fluid or whatever, they caused cardiac arrest, and it's only if your heart is completely in good shape, like if it's a healthy heart, you can't do it. And I got the cardiac arrest again, so they said they have to install an ICD, because I wouldn't be.
Do you want to just explain what that is, the ICD?
It's a kind of pacemaker. It's like a little machine which is connected with your heart, so in case you get a cardiac arrest, you get a shock.
The defibrillator thing.
Defibrillator, yeah. So then they installed. Then I went home, and after 3 months I went back to work, and my pump function was not like, I mean, in the end it was the same like Dwight, but mine went from, let's say, 55 to 65 is pretty normal. It went down to like 47, so it was not normal. But after like a few months, it got back to 52, 53. So I went back to work, and then I had in January 2011, I had problems again. So I had a heart rate, it was only 23. So that's even
23.
It was a AV block, so it was not every heartbeat was transferred over. That was a problem. That case, and then in 2011 the heart got weaker and weaker. So they did a lot of tests. They did a lot of biopsies. They thought it's like a myocarditis. It's like an inflammation of the heart. They never figured out what happened. And then it got weaker and weaker. And then in my case, I was in the end a bit lucky that it's not went to my kidneys or my liver. So my gallbladder they had to take out my gallbladder. That was in the end of 2011. And in that operation, I really got, because of the anesthesia, so I really got problems in the operation with the heart. The heart was that weak, and I couldn't even, it was not brushing my teeth, but as Dwight said before, I was not able to walk 100-meter flat in like, so what we did, because of the ICD, we did a lot of kind of threshold tests. So my threshold was 40 watt.
Sorry, say again.
40 watt, not 400. Yeah. It was 40 watt, 40, and 40 watt threshold is like, if you are like 70 kilo, you needed to just walk straight, slowly. So if I started walking like a stair, I was like done, yeah. And then in the end of 2011, I was so done. It was my 40th birthday, just like a few days after I had this gallbladder surgery. Then they transferred me to the transplant center. And in the transplant center, I got a lot of medication and stuff. And after 4 weeks in the transplant center, I got a cardiac arrest again. And then they told my family I have to live only 12 hours, like 12 to 24 hours. And the idea was to install a LVAD, like it's the same. It's like a half of an iPhone, let's say, like a device which is also connected to your heart. And then you have like some cable which comes out of your body that goes to a battery. And so it's for the left ventricle, yeah. And it's like called bridge to transplant. So if you don't have a heart, you can live with this machine. But in my case, when they opened me up, they saw that the right ventricle is completely done as well. So they thought, we have a problem here. So they put me on an ECMO. So it's a little, let's say, I don't know, it's not to make it too medical, but it's a heart-lung machine, small heart-lung machine. So I had it's not a cable, it's like a small water tube you use for watering your garden. I had one in my left leg and one in my upper body. And so the machine put oxygen to my blood just when it was circulation. And the idea was to get rid of the ECMO and then live with the LVAD. But in my case, I couldn't get rid of the ECMO. So I stayed with all the machines in exactly the same position, like almost 180 days bed rest.
Is this
And
sorry? Is this why they were waiting for a transplant? Is it?
yeah, waiting.
Or
Yeah, I was on the high urgent list. So that's in Germany. We have Germany is in the transplant. What do you say? It's like many countries. It's a community with many countries like Spain, Austria. So everyone donates organs in the system, and then you look.
Okay.
You are on place 6 on the list, and you get on place 5, and what Mark said before, and then you just have to wait. And Germany has not the best law, so the average waiting time is around like 6-8 months. And
Wow,
in my case, on the ECMO, normally every 2 weeks you have to send your blood values to the center in the center is in Holland. And they look if you are still high urgent or not. But if you are in ECMO, you are done. Yeah. So I was high urgent the whole time. So on the 8th of June, then in the end they got a call. So I was then first on the list, and then they transplanted me during the night from the 8th to the 9th of June in 2012.
Wow. So you're saying, just to clarify, are you saying the ECMO thing is you're basically bed rest? So you're in bed, and you've got catheter putting oxygen straight into your blood because your heart is not able to do it for you because you can't.
The ECMO,
you can breathe,
the ECMO
but you can't.
The ECMO is just basically sort of, you could put it this way, like cleaning the blood and oxygenating the blood, right? It's acting like, the heart and lungs will do that. The ECMO machine is doing that. And when Elmar told me that, I actually never heard someone being on ECMO that long. I didn't believe him. I said, that's not possible. But Elmar, also because Glenn will understand this from sport. Tell him what listen to this, Glenn, is crazy. What was your resting lactate, Elmar?
My lactate in resting, before they put me on the ECMO and on the LVAD was 11 millimole.
11 millimole. Okay. So for people just to know, resting lactate normally is about 1 millimole per liter. And if you're doing like a 1 hour time trial or something, you might hold 5 or 6 for an hour, and that's hard work. If you do a VO2 max test, it might be 11, 13 at the end, depending on your types of fiber types and things like that. But you were basically like maybe at the end of a max test, people, but you were like that the whole time.
Yeah, but if you look at on this side, because I listened to a talk of Andre, and he mentioned like if you have a guy who can run like a 10K in 27 minutes, the heart is exactly doing the same, because my heart was not pumping anymore, but I was in the same situation. So I was just in the bed, and I had 11 millimole. So it's and the VO2 max before all the bed rest was 9. I mean, if you vacuum clean your living room, you need 7. So that's very easy. If I started doing something, I was completely exercised
at your
like
max.
Yeah.
So for people, usually we say your basal metabolic rate, your basal oxygen consumption is about 3.5 mils per kilogram per minute, and yours was 9. So you could basically get up to like 2.5, 3 times your resting metabolic rate when you're laying in bed, and then you'd be maxed out. Yeah.
That's what.
No, then he was on bed rest for 177 days. So
that was before the bed rest.
Yeah. So you remember Ben talked about the classic Dallas bed rest study where they had 5 25-year-olds and put them to bed for 30 days, and that was 20 days. They aged by 40 years. Elmar's was 9, but he was on bed rest for 177. So he basically was running a marathon at rest, would be the equivalent of his lactate. He was exhausted at rest. It's phenomenal.
It's hard to get your head around. Yeah. So did you feel exhausted laying there at rest?
Not really, because by the time I was on the machines, I felt, let's say for the situation, I felt okay. Because I had enough oxygen, and it was just a situation that I was just lying in the same position the whole time. That was kind of hard, and it was more like that someone came like a physio and
bed sores.
So I had no problems with my skin, but I had a lot of tubes inside, like a catheter in my blood. So couldn't
Can
do
I
anything.
ask you a strange sort of question, I guess? So I'm thinking you can still breathe, your breathing's fine, but your heart's not doing what it should be doing. So when you're getting oxygen put straight into you like that, do you still? No, I guess it's the carbon dioxide that affects your breathing. Anyway, so you're still breathing pretty normally, I guess. Is that what it?
Pretty normal. I
Yeah.
was able to eat and breathing. I mean, I was just lying there. And I think the lactate, if you would have measured it on the ECMO and on the LVAD, it would be pretty normal. So I was just lying there because the pump was doing the work of the heart. Yeah. The same
And Mark's never seen anyone go that long, yeah? Because what would normally happen, Mark? The person would die, or what would happen?
Yeah, they'd have to get a transplant. I mean, that's such a long time to be on ECMO. It's very long. So yeah, so these when I'm talking about fatigue, it was pre-ECMO where now he would have more favorable oxygenation. But prior to that, when the LVAD failed, and talking to Elmar, that's when his lactates were 11. So they had to put the ECMO in to normalize his oxygenation, and because his pump is just not pumping anymore. He was so anaerobic.
And I
Yeah.
guess you're still breathing
Yeah,
normally because you're breathing, you're blowing off the
so
carbon
no, I mean,
dioxide.
if you don't get the heart, you're unfortunately going to pass away.
Wow. Okay. So Elmar, we all know you ended up getting a heart, thank goodness, or you wouldn't be here now.
Yeah.
So how did that happen in the end?
Yeah, it was 8th of June, and then I just the guy who was responsible in the night shift, he came in, and I was just watching the European Championship in soccer. It just started, and it was the first game, and
You're like, yeah, no, come back in an hour and a half. Yeah, I'm sure you
and I
didn't say
couldn't,
that.
like, actually, the funny story is that on the when they brought me to the surgery room, I asked the guy if it's possible that they finish it up quick, that I could watch the German game. But that's the first thing actually I asked was from my mobile phone on Sunday. The game was on Saturday, and I asked how Germany played. They won 1-0. So
put your priorities right there, huh? So wow, okay. Now I know Mark, just to tie it in a little bit, one thing you said to me before we did the chat was the time from diagnosis to transplant is important. Did you want to just talk a bit about that and then with these two guys?
With respect to, sorry, the time as far as
you were mentioning, the time from diagnosis to transplant is important. I was just wondering if you could flesh that out a little bit, and with these two guys,
Yeah, so I think every story is kind of unique, because Dwight didn't have the compensation sort of to the length that Elmer did. So it does vary from person to person. But obviously, if you can prevent the deconditioning, the disuse, the bed rest like Elmer had, because like the recovery for him post-transplant took a lot longer than Dwight, because his anti-gravity muscles, he couldn't even stand up. You know what I mean? So you had talked about prehab. It's really interesting because there's a number of criteria to be listed for a heart transplant, but one of them is actually your oxygen uptake. And roughly this sort of golden value is around 14. But the group from UCLA has found that in individuals with heart failure who can do some rehabilitation and improve their VO2 over 14, 15, 16,
okay,
they actually do as well as some people who receive a heart transplant. So where you can do some rehab if you're able to, in the course of the syndrome, some people may get off the list, some may not, but it just sort of it's really beneficial in the post-transplant, right? If you have an abbreviated sort of stay in the hospital. So Elmar will probably talk a little bit about his rehab. It took him a few months just to sit up and move, and whereas Dwight was getting up pretty quickly.
Okay, and that's because of how the condition that they were in beforehand.
Yeah, because we often think about, because it's cardiology and heart transplant, the heart, but the skeletal muscles are taking a hit, which already took a hit with the antecedent heart failure. The vasculature becomes more stiff, less compliant, but it was already stiff and less compliant as part of heart failure. So the longer and longer you're waiting, you also don't have heart failure of the heart. You've got vascular failure of the blood vessels and skeletal muscle failure of the muscles. So if you can attenuate those declines, the recovery is going to be better.
So if you did prehab to try and improve the muscle, for example.
Where you can, or have a less prolonged time to transplant. But again, it's so individualized, it's hard to say, because Elmar and Dwight are different. Everyone you talk to is a little bit different.
Exactly. Must be hard to, when we do research, you want to have a kind of homogeneous group and things like that.
Yeah, so we did the study.
Studies with
and we it's homogeneous in that it's homogeneous that they're heart transplant, but there's a lot of disparity thereafter.
Exactly. So so with Dwight, I think you said your heart donor was 23. Do you know Elmar, your heart donor?
No, because we have a law in Germany, so now the donor's age, or if female or male.
Oh wow. Okay. All right. So why don't we?
And they are very, in terms of privacy and all of that. I have a certain amount of information, but very limited. And they allow you to write a letter to the donor family. And obviously you thank them when you say, I'd love to meet you and thank you in person, but then it's up to them whether they want to respond to that or not. And so I didn't find out until a year later by word of mouth by somebody that wasn't supposed to say anything, that my donor had committed suicide and left a note to donate his organs.
Oh crap. Okay.
So your comment or your question there about kind of at what point did I actually realize that somebody was going to have to die in order for me to live is a relevant one, is valid, because initially I never even thought about that. It was all presented to me as very scientific and medical process, and it wasn't until one weekend I went down to the clinic prior to the transplant and they said, this could be your weekend. And I said, what do you mean by that? They said, well, it's a long weekend. And then all of a sudden it connected. And I said to them, I said, don't say that. I don't want to hear that. So yeah, coming to terms with that.
Do you mean it's more likely someone's going to die over the long weekend?
Yeah.
Wow. Okay. So did you ever get a response from the family or anything like that?
No, I've sent a note off to them twice at different points, directly after the transplant and a number of years later, and no response.
It must be really, especially the way they died, it must just have a lot of emotions involved. Okay, wow, that's incredible. All right, so so if we go back to seeing we're with Dwight anyway, it's worked out well. So you've had the transplant. So what was it like? You wake up, I'm alive, or do you just feel terrible? Or like, what was it like? And then you eventually end up like this amazing athlete. This is the first person to do an Ironman as a heart transplant recipient.
Well, the first thing I remember is that, and by the way, while I was still sedated, I started to bleed internally. So they had to take me back in a second time and open me up and fix the suture that had slipped. Okay. But the first thing I remember is a voice saying, Dwight, can you move your fingers? And I thought, well, that's a stupid question. Of course I can move my fingers. But then to get that signal from the brain down to the fingers, I had to work at it. Like I actually had to think of it and make it happen. And then the second thing he asked was, can you move your toes? And I remember thinking, wow, that's a long ways down there.
So it went from a stupid question to a hard
I had to think longer.
Wow.
And moving my toes. And that was the whole point, was to see if a sign of brain damage due to the oxygen. And so that's the first thing I remember. And then within 4 days, I was up and walking around the unit. And in 7 days, I was down in physio. And by the way, that was the highlight of my day. Every day was to go down to physio and get
Oh,
on
was it?
that bike and exercise.
Oh, that's
So
amazing.
then I was released 13 days later, and I had to spend 3 months in Tucson. And miraculously, the Lord provided a place for us to stay that was completely paid for and furnished, so we had no cost. And Colleen my wife still worked in Phoenix, so she'd go to work Sunday night, come back on Friday night. And it's about a 2.5 hour drive one way. So we did that for 3 months, and within that 3 months, every day I would go back to the medical center for checkup and for physio. And by the end of 3 months, I was riding my bike 6 miles one way to physio. I would then run 3 miles.
No
And
way.
then I'd go back another 6 miles on bike, and then I would swim about 500 meters in their pool there.
Hang on, this is, did you say 6 weeks? How long after the transplant?
3 months.
Oh, sorry, 3 months. Yeah, but that's still, wow. Okay. I guess this is not your average transplant recipient. Is that right, Mark?
Yeah, they kind of wanted to restrain me or keep me from not pushing myself to that point. It's like with Mark, when he asked me to do this exercise study with him, I said, but you have to promise me something, there's always that give
Another
and
promise.
take.
Yeah.
And so I said, you have to promise that you're not going to restrict me, or you're not going to try and control what I can do.
Wow.
You're going to let me go at what I think I can accomplish and push me, right? So he did, thankfully.
Hang on. So how did you, because you were like that before the transplant, right? You were wanting to push. And then after the transplant, because we're talking about, quite a long while ago. And as you're saying, people weren't really pushing exercise. What made you, did you just have this inner feeling that exercise was good for you?
Yeah.
And to push it.
Yeah. I mean, in terms of internal motivation and my own faith and belief is that life is a gift from God. And I am responsible, not just to the donor family, but responsible to take care of what I've been given. And a big part of that is staying physically fit, eating right, and exercise.
But you just sort of knew that even though some of the experts and things weren't really there yet, you just knew somehow that pushing this heart would be a good thing.
Yeah. Yeah. And along the way, I had people saying, you shouldn't be doing that. Like, that's dangerous. I was actually being told this is dangerous for the heart. It is dangerous for you. You shouldn't push it like that. And fortunately, I had other advice, which I chose to take. And that was, do what you do and push and work hard, and fitness is important, and it's not going to damage the heart.
Is that what you were saying, Mark, or?
The thing is, I only met Dwight 18 years post-transplant.
You said that.
So the first time I met Dwight was nearly 20 years. And remember, the average survivor at that time is 11. So he's already outlived a decade of what the average person is doing. So when I met him at 18 years, I couldn't even believe him. And then we were like, well, you want to train? We started doing intervals and strength training, and he was doing intervals at 300 watts. Like we trained him really, really hard. And then, like Dwight said, and then he said, well, I really want you to know what I can push this heart. So one of my PhD students is an elite triathlete. So they started training him to start his journey to do an Ironman.
Okay. Wow. Okay. So how do you think he's achieved? Okay. So both of them have got really high achievements, but do you think Dwight has achieved this because it's Elmar. I was trying to think. Elmar's the one that's got the reinnervated.
So what's really unique about both of them is they've both have got probably what's called non-ischemic cardiomyopathy. So they didn't have ischemic or heart attack or vascular disease. So I think the only transplant recipients that can do what they're doing have had to have an antecedent beforehand type of heart failure that's not like a heart attack mediated heart failure, where you've got vascular disease for a long time as well, because that's the common thing between both of them. One was very fit before, one was very active before, but not highly endurance trained. So a common link is that active or fit. Both are non-ischemic and relatively, younger. So what we say when we publish them is there has to be a legacy effect of what they had done pre to post-transplant. It's just Dwight now is 2 decades when we first met him. And I can't emphasize that enough. We never see a VO2 2 decades as high as his. So there's something
Dwight's 37. Is that what you said? 37 years post?
37
well,
and
86.
a half.
Yeah, okay.
Yeah.
And what's his VO2 max now?
Well, so Dwight at his highest, we've measured his fitness over 2 decades, and his average is around 52, which is equal to an endurance trained individual who's not having a heart transplant recipient. Most recently, we tested him, and it's around 26.4. So it's gone, but in the last few years, his training has gone down. He had a couple of issues. But having said that, you have to put in the context, yes, it's not where he was when he was an Ironman, but he's still 1.5-fold fitter than the threshold for independent living. Where remember how pre-transplant he couldn't walk a flight of stairs? He's still well above that, and he's almost 2-fold higher than the VO2 to get a new heart. So although it's come down due to aging, and reasons why it's come down is because his heart rate is not as high as it used to be, and he's not extracting oxygen as well. Because when Dwight was doing his Ironmans, he was almost nearly extracting all the oxygen in his body because his cardiac output's not that high, believe it or not.
Yeah, so this is the crazy thing, because we had emails before we've chatted. So you were saying because his cardiac output wasn't that high, so his oxygen delivery wasn't that high, his body adapted by extracting almost every bit of oxygen that it got.
And Elmar does the same thing as well, except Elmar's cardiac output's a bit higher, but he's also 10 years post younger than Dwight, or 20. So his pump is bigger. But Elmar's also a very good extractor. But now, having said that, their cardiac outputs are still higher than most transplant recipients. I'm now comparing him to athletic people because they were Ironman triathletes, right? But relative to heart transplant recipients, they're still 40% higher than them, but they're still 40% lower than an elite triathlete.
Which is, okay. So we talked about how you've got you don't really exercise. Well, it's before we came on air, we were sort of having a bit of a joke about how you've got a bike in the background, but you don't really exercise. It's more your wife. But I thought you ran.
So what happened was
with the guys.
So what happened was Dwight came to me one day and he said, "You're the biggest hypocrite I know. You're short, you're fat, and you're out of shape, and I'm gonna outlive you." And I was like, "Holy, like this is amazing!" Like he's actually right. I am short. I was fat, and I said, "Well, what do you want to do?" He said, "Well, I want you to run a marathon with me." I'm like, "I'm not built to run," but I said, "Okay, I'll do that." So, but I said, "Dwight, only one thing. Like I'm very, very competitive. So, like if we do this, I'm going to beat you." So we ran the Vancouver Marathon, and one of Andre Lagersh's friends, our mutual friend, is a fellow by the name Dr. Aaron Baggish. And Aaron was the sport cardiologist for the Boston Bruins, the Red Sox, and the Patriots, but he's also was the medical director of the Boston Marathon. So I phoned him and said, "Listen, we've got this heart transplant recipient. He's done this Ironman race. He can't qualify for Boston, but can you get him in?" And he said, "Absolutely." And maybe I should ask Dwight to tell this story because this is not trivial. Again, their lives are very interesting because the year he went to Boston was 2013, and he was 6 blocks from the finish line when the race stopped.
With the bombing.
Correct.
So he did not finish because of that.
Correct. So then he got invited to do the 2014 race. So now I phoned Aaron and said, "I'll never qualify, but I want to run it with Dwight." So we ran it together.
Okay.
Yeah.
And
So,
I'm guessing he beat you actually.
Yeah, well, actually, together is not exactly correct or accurate. Because you know how at the beginning of the race you're in what they call corrals, and they put you out in segments. So Mark wanted to be right at the front. And, the elite racers are at the front, right? And I said, no, I'm not going out in the front. Like, I'm not going to run like that at the beginning. But Mark took off like a shot and left me in the dust. And
he hasn't read the pacing literature, I guess.
right. So he's getting to the end of his race, and I'm still coming up behind him, and he's getting concerned because he's dropping off and he's struggling to make it, and he's worried that I'm going to catch him. Well, I didn't catch him, but
He didn't.
in any case, I think I might have been in better shape than he was at the end of the race.
Okay, well, that's interesting. So he is a competitive man.
Yeah.
He did manage to beat you, as he said he would. But wow. So at that time, is it right? You were the first heart transplant recipient to finish a marathon?
An Ironman.
Sorry, Ironman. I'm getting mixed up. So when was
yeah.
the Ironman? When was that?
2008. It was the Canada Ironman.
Wow. Okay. Yeah, I actually saw that on YouTube, so people can look that up. So that's amazing. So I guess, okay, what I'm starting to think, okay, well, why don't we get back? So if we go now to Elmar, so what was your experience post-transplant?
In my case, it was a bit of struggle because Mark mentioned before that because of my not existing muscles anymore, because of the almost 7 months at bed rest, I had to learn to sit and stand up and then to walk again. And
okay.
But after 2 weeks, I had the ergometer bike in my room. So the first thing I did, I switched it to 41 watt. That was 1 watt more than my threshold was with the old heart before. And I think it was pretty much the same. So after 4 weeks, I was sent home, and the first 400 meters I walked, my father stopped it, and it was over half an hour. So it took me 1 round in the stadium. I just ran this week 16 times 400 meter, and it took me less than 90 seconds for everyone. And there it was like 31 times that what I do now. So
you say one lap, 400 meters took you
31 minutes.
Holy mackerel.
And then I had really pain because I did Ironman and marathon stuff before, and I don't know, it was 50 times the amount of the muscle fatigue, whatever. I cramped a lot, but and then I was sent home, and it was a bit like Dwight, I think. So I was not going to like kind of rehab or something. So I just started walking. I just went back where my parents live because in Cologne, I would have been alone during the day at least. So I started walking, and in August, so it was like 6 weeks after the transplant, I started cycling again. So I did my first bike ride, and there it's kind of like, it's interesting because no one told me because of the innervation of the nerves. So when I cycled like the first time, like 30K or so, during the ride, I called the transplant center. I said, sorry guys, but there's something wrong with the heart. Yeah, if I drive up like a small hill, so my heart rate is not responding. So what's wrong? I have to come back and say, no, that's normal. Yeah, you have to live with that. Yeah, and actually it was great because I made this yellow paper what I wanted to do in the hospital before I was sent home, and I googled. Yeah, I googled heart transplantation marathon, heart transplantation Ironman. And then I found Dwight. Actually, I found
you found Dwight.
I found this PhD student of Mark, and then I started training again. Most it was cycling, and after half a year, because I really had problems with my muscles, after half a year I started running 500 meters 3 times a week, and I add 500 meter every week. And in Eastern, so in a few weeks, it's a big Easter run here. And that time I did the 10K run. I finished that in 1 hour, and then and then actually I started doing a lot of stuff from this yellow paper. So I did a bike race, and I
sorry, what was the yellow paper? Sorry,
just made this Post-it. We call it Post-it.
Yeah, Post-it note. Yes.
It's like a bucket list, whatever you call it.
And you would start ticking them off
before you die. But mine was what I wanted to do in life 2.0, let's say it in this way. And then I in July, so 1 year after that, I climbed the highest mountain in Austria, and exactly 1 year, on the 9th of June 2013, I did my first triathlon again. So it was my first day. And in October, I already ran a half marathon. And in this year, I started with doing tests. So I remember the first test I did was 8 months post-transplant. So my VO2 max already was 37 or 32, I think 37. And then the guys, I was sponsored from this institute, and the coach Björn Geesmann is the coach of Patrick Lange. He won Ironman Hawaii twice.
Yes. Mm-hmm.
And they made me training plans, and then they said, okay, you are not in top shape, but your shape is okay. If you want to do an Ironman, you will finish it definitely in like 13, 14 hours. It's no problem to finish it. It's just if you want it. I said, okay, let's give it a try. So I did a half Ironman, and 2 years after the transplantation, in July 2014, I did my first Ironman, and that was exactly the same time I did my first Ironman with my old heart in 2005. It was the same race.
No way.
And my goal actually was to do Ironman Hawaii, but qualification was not possible with my old heart. So after heart transplantation, it's hard to qualify for Kona because you have to be one of the best in your age group. So I was sending lots of letters back and forth to Andrew Messick. He was the former CEO of Ironman. And then he said, if you do an Ironman in a proper time, you get a wildcard for Kona. So I did my first Ironman with a new heart in 11 hours, 30 minutes. And then I got the invitation to Kona. And then I did Kona in 2014. And actually since that year, I did an Ironman every year. So I did 10 Ironman now and 22 half Ironman, and I did a lot of stuff like I think the Ironman sounds that is it's a big endurance event, but in my case I did some stage races because of the immunosuppression medication. It's hard to be fit like 7-8 days in a row. So what I did, I ran 275 kilometers over the Alps. It's like a Transalpine run. And I did exactly what I found much harder was the Cape Epic. So I did the Cape Epic the first time in 2017 because in 2014, it was also on my kind of bucket list. I wanted to be in South Africa because I wanted to see like the museum of, Mark mentioned that Christian Bernard is the first. And then I was training a bit in South Africa. Cycling, and then I met several people, and they said Ironman is not a big thing, you have to do the Cape Epic, that's a proper sport. So I said okay, that's just cycling. And then I said okay, I will come back and I do the Cape Epic. And then I really underestimated the Cape Epic a bit because I was not a proper mountain biker. So I crashed in the Cape Epic, and they had to screw my knee a bit, but I finished it. And then I did it a few years ago. I did it again. So I did again the Cape Epic. So
how far is that? So it's a mountain bike race.
It's a Tour de France it's a kind of Tour de France of mountain biking. But for the Tour de France, you have to be professional athlete. For the Cape Epic, for example, the year I did it it starts with a prologue, and behind us on the starting ramp was George Hincapie and Cadel Evans. And Cadel Evans won the Tour de France actually.
Exactly, and they were Australian.
So that's actually it's for mountain bikers. It's like Nino Schurter, he's Olympic champion in cross country. So all start, you're in the same race like in an Ironman, you race against the top athletes, but they are like a few hours faster than.
Sure.
So that's actually the story. So I did some mountaineering with a new heart, and yeah, I'm still racing and training, and the good thing is that I'm not getting much weaker. It's just, I think my resting heart rate, it was in the beginning really, really low, and now it's around 50, which is still pretty good. And my maximum is not 189 anymore. I think it's because of the age, but I often, yeah, when I compare yourself as an athlete with your old heart. But the thing is, now I'm 52. Yeah, when I run a race like a half marathon, and it's a Easter run in 3 weeks again, it's a big race. Then I compare myself when I ran 121, and now I run 131. But now I'm ranked in my age group much better than when I was 30 years old, before the transplantation. So if you look at that, I think, I don't know, it's just like my thoughts that I maybe wouldn't be fitter with my old heart than I'm with the donor heart. So I have a lot of friends that just run 1 minute faster, or a lot of my people in my age group are slower than me. So
well, guess what? You know, Mark's very competitive, right? We said Mark's very competitive. I think if Mark was in a race with you, he'd be saying, "Hang on, he should be in the age. He should be in the age group of his heart, not the rest of his body, right?"
Yeah. Mark always said he wants to do Boston Marathon. I have a qualification time for that, so he can get a wild card, and then we can do it.
There you go. But I was saying, Mark would be saying, "Hang on, you shouldn't be running. You should be running in the age group of your heart, your new heart, to make it harder for you." So that's amazing.
But just I want to mention that it was really, I think I would have started moving, but if you have a dream like doing an Ironman again, then I'm really thankful. 2 years ago, I met Dwight in person, and I love to see him and thank him personally for like being a role model for me, that I saw, okay, this is possible. Yeah, even he was not winning the age shoot or something, but it's crazy that he did it. And what's for me, especially because I'm 12 years, which is, people say, okay, that's long, but Dwight is still sitting there and he's still active, and that's what I wanted to be. Yeah, he's really like, for me, it was the best thing to get to know his story and the people around him, like Mark and Ken, and yeah, that was so cool, because no one said do interval stuff, and Mark said, okay, we tested Dwight and do that. That's good. Maybe your nerves got back. And 1.5 years later, in a training camp, I saw really that it was suddenly there was like a connection. It was a crazy moment, because I thought my bike computer is paired with the heart rate belt of my friend, and my friend was not wearing a heart rate belt on that day. And I said, "Whoa, that's crazy! My heart rate is increasing much quicker than ever before." And there was something happened. I don't know, but that was a crazy moment.
Yeah, so and it's just to interject, sorry, Glenn, because I think this is not a trivial point I'm going to make. If you tested all the transplant recipients in the literature that we can find in the database, if you put them on a treadmill, they can exercise for 1 minute at 141 beats per minute. When Dwight did the Ironman for 15 hours, 0.7, so 15.7 hours, he exercised at that heart rate. And Dwight can also exercise at Elmar at a heart rate when he does the Ironman and longer races above that. They're the only two people I know that can exercise for 14 to 16 hours at a heart rate that every other transplant can do for 1 minute.
Wow.
It's kind of, these are like
crazy.
These are sort of like in the transplant world, they're the elitist of the elite. And it's remarkable that Dwight, of course, I don't know his pre, but Elmar runs these Ironmans now faster with his donor heart than his own. It's crazy, and it's unheard of. So,
Yeah,
but again,
he's
there's
getting
been
older as well.
150,000 transplants or plus done. These are two, and we're aware of a third, but these are the two sort of the elites of the elite. And again, I'm not suggesting everyone should aspire to do that, but their physiology is so unique that we can learn what the allograft can actually do in the long and short-term post-transplant, because it's like Elmar now qualifies for the World Championships. He actually qualifies. So yeah, it's remarkable.
So he's not getting a wild card or whatever. He's qualifying based on his times
Yeah,
for his age group.
he gets that and he gives it to me.
I just give the finisher shirts always to Mark.
So I was, sorry, I've suddenly lost my train of thought. Oh yeah, sorry. So when you say, you know, that these guys can hold 141 beats for the whole Ironman, and the average heart transplant recipient can do it for like 1 minute, what's going on there? Obviously, these guys, the elite, are the elite. I'm thinking about the other people. Is it because they don't exercise at all, or like, or do they? What is the average heart transplant? Because we don't want people to think this is, as you said, this is the average heart transplant recipient. What do people normally do? Do they
So
not
they all
exercise
get
much,
some,
or
they all get some form of rehab. And remember, when you get the heart, your VO2, even with minimal training, will improve 30% because that allograft is pumping very well. So now you get above your threshold for independent living, sort of 14, 15, 3 to 18. You'll get above that. In my experience, a lot of people, I think, oh, I can now do the activities of daily living. And I think, unfortunately, and I don't know this to be the case, but when you look at the VO2s, it goes up from 13 to like 19, 20. And when they've done some short-term longitudinal studies, up to 5 and 10 years, it's only 20 mils. So that suggests to me most people are becoming sedentary, unfortunately.
they're just happy to be back at daily living?
It has to be the case if your VO2 is now staying at 20.
So
Right?
they're just happy. What I mean is they're happy with that. They're not trying to get fitter.
Again, I haven't done
yeah.
any phenomenological studies looking at the lived experience, but in my experience of those who I have worked with, yeah, they're pretty happy just that they can walk up the stairs, right? Because unfortunately, a lot of the things that get you a heart attack, one of them is sedentary lifestyle. So maybe you just revert back to your old lifestyle. What's unique about Dwight? I mean, cardiac outputs are higher, vascular function's probably a bit better, but their skeletal muscles are phenomenal. So we need like Scott Trappy in their group to biopsy them, right? Because they're probably much more oxidative, greater mitochondrial density, greater capillarity. Because how are they going for 14 hours when one can do it at 1 minute?
And extracting all that oxygen as well.
Correct.
Which
Because that's
suggests
one
they've
of
got
the things. Right. Because one of the things with Dwight, his training's gone down in the last 5 years. He's just not extracting he's nowhere near, he's 50% less of an extractor now.
Okay, so it's probably the muscle, the muscle capillaries, the muscle mitochondrial
Absolutely.
function, etc.
Absolutely, because as you know, I mean, even the hearts, right? Like you can transplant the heart, but you still have the weak links of the vasculature and muscle if you don't train. And now when those become deconditioning, but still up to 40 years, Dwight scores what we now will know is the upper limit that you can ever have at 40 years when your activity goes down a little bit. It's 26. 26 is still like a 35, 40-year-old individual who's average.
Yes. So Dwight had a VO2 max.
Can I just end with that from a personal experience? Is that this whole thing of transplant recipients not maintaining a lifestyle of exercise and fitness after the 3 months of doing physiotherapy after a transplant. And Elmar, I don't know if you can attest to this or not, but when I have shared with people and spoken publicly in regards to the value of exercise and fitness, especially heart transplant recipients, is that the response I get is, wow, you know, that's incredible, good for you. But I could never do that. Nor would I really want to do that. And like Mark said, you know, I'm just happy to be able to walk a flight of stairs now that I've had a transplant. And to some degree, it's a lonely world to be that person, right, Elmar, in terms of not having that camaraderie with other transplant recipients that have same view of life and fitness and desire and motivation, because it's just you. And thankfully, we've got Mark and got Ken Reese and transplant team and guys like Elmar as well, who have come together and helped encourage and motivate you, because you don't get that in the transplant community.
Is that where you find Elmar as well?
Yeah, a bit. It's a bit like Dwight said. What I see, and because I went to transplant games, so you have like World Transplant Games, like last year in Australia, where you race against the whatever lung from Austria and like the liver from Kenya and the kidney from South Africa, yeah. And what I figured out that like if you take the endurance sport events like triathlon, cycling, running, swimming is a bit of technique, because there are two guys from the US which were college swimmers and they swim really fast. But I think you don't need the connection of the heart. If you jump in, do 50-meter all out, I think it's the heart is important, but I think the muscle, and I don't see really people winning something, but at least you see some people which are, I think, much better than the other people. But what if you look at liver or kidney transplant, they are totally fit. So I'm not sure, because I'm giving a lot of talks. So I always say, I think if you get a new heart, and if you are really lucky, you can maybe get back to, I don't know, Mark will know that better, maybe like 70% of what you were able to do before, like 70%, but to 100%. But the problem is, I mean, even Dwight's stories is he did it in to 8, yeah, and then still it was published. So if you are like working in a transplant center as a doctor, you could have read to the stories, but maybe there's no time reading this, because it's like a story. When I got transplanted, and a year after that, I already was in some media, and then one doctor from the transplanter where I got transplanted he saw that, yeah, and then he said to me, because when I was at the annual check, he said, well, that's not good, yeah, what you are doing is not good. So it's and then now 10 years after that, he's not working there anymore, because he's not because he's not a good doctor. He just went to another hospital, and I did another Ironman, and he said that he loved being so wrong.
No, great.
Because he said I should keep on doing, because they were not thinking, because it's like surgeons, yeah. They put in something, then you get your medication, you get a list that you don't have a cat and a dog and blah blah blah, and don't have like flowers in your apartment, and don't eat this and that. But no one says, and again, it's not like you should do an Ironman, but I think working out for a heart transplant patients is much more important than working out for other, because of the side effects of the medication. You mentioned that in the beginning, like the blood pressure gets up and so on and so on. And the problem in my case today, I had another heart transplant patient, because what I did, I posted on Instagram what Mark was in the email we were sending back and forth about the topics of our podcast. I put it, people get interested, because, what about the nurse? And the thing is, you have to know your limits, and then you have to go on your limits, because I always ask what I'm eating. It's nothing is special what I'm eating. I have like a healthy diet, but the thing is, I know my threshold, and then I can do intervals and stuff, yeah. But the thing is, they never really do it like a threshold test after 1 year. If they would every heart transplant person, they would put on a bike, and then they would start exercising. And when the heart rate is not getting up quick, it feels not good, because you have less oxygen than you need. But then you just tell this patients, keep on going, because there's a doctor. What I did like VLA max tests. I pushed over 1000 watt. Nothing happened. I was still on the bike. Yeah, there was no doctor around. I just did it. And the thing is, that's what they should do, because heart transplant athletes or patients are sending me emails and they say, oh, I started because I want to go back hiking in the mountains. They start hiking and then they say after like 500 meters, it's so much pain in my legs, and that's because of the medication. I say, no, it's not because of your medication. You have to look at your heart rate. Because you are climbing up, you need a heart rate of 130, you just have 90. And that's a problem, because it's a lack of oxygen. And that's a bit, I mean, if I would, that's I say to the transplants, and if we would have two groups and I would train the one group, they would get so fit. And then I think it's the same what Dwight and me mentioned after the transplant, and we got fitter. If you go up a stair, it took 5-6 minutes. You were like you are climbing 5 stairs. You sit down on your sofa, and then after 5 minutes, your heart rate starts increasing. But if you are and your muscles are fit, you just can walk around and you can run up and down stairs. It's pretty normal. Yeah, and that I think the life would be much better with exercise, and that's what we talked about. It's just okay. I can walk the dog, and then I can go to my job and I sit on my sofa. So it's even much more important to exercise, I think. And we are not talking about Ironman, yeah. But
no.
You need to have a goal. If it's a 10K run, if it's, I don't know, if it's skiing, if it's like climbing a mountain, if it's hiking, whatever, yeah. But I think that is so important. I always tell that in my talks, and yeah, but.
It's pretty amazing that you've got people that don't exercise enough, which is the average person, and they're getting exercise advice from someone that's had a heart transplant. Like you're trying to motivate them. Come on, you can do it. Just get out the door and whatever. You're trying to motivate them. It's like back to front, right?
But the funny thing, Glenn, is I'm one of those, because it was Dwight. I have all this schooling, and it took Dwight to say, you're a hypocrite, and he's right. Like, so I know where that's coming from, because that was me. But again, the goal is not to get everyone to do Ironmans. It's to get everyone to follow the ACSM guidelines, be a bit more physically active, right? You don't have to do an Ironman, because as we all know, you age by a decade of VO2 1% per year. So I worry about if you're only 20, in 5 years, you're going to be back to a VO2 that you're going to require others to help you. So, this podcast isn't to say, here's the triathletes, everyone be a triathlete. It's no, just move. If it's 10 minutes, do 15, right? But these are phenomenal athletes. To me, they're like, I know everyone's interested in the under 2. I'm more interested in these guys in some ways, because that's such unique physiology. Because if you take the fastest marathon runner, and I've modeled this, and you denervate them and you put them in bed for 177 days, they're only running the marathon now in 3:30.
Yeah, right. Wow.
Right?
Okay.
You know what I mean? Because they don't have the heart rate, they don't have the muscles, they didn't have the deconditioning. So,
yes.
To do what these two have done is absolutely amazing.
It's interesting, because pretty much every podcast I have, we'll talk about this and this, the optimum way to get muscle hypertrophy, the optimum way to get this and that. But in the end, we always say, look, we just want people to get out.
Correct.
And just do, and we're saying the same here,
Yes, some is better than none, and more is better than some. Even if
actually, can I ask you the question? So you just mentioned, it was a good reminder, because I was wanting to bring it up. The VO2 max tends to decrease year by year, partly because your maximum heart rate decreases by 1 beat per year as you age, from about 20-25 onwards. Does that happen in heart rate recipients, heart transplant recipients as well, or not?
Yeah. So the trouble is it's hard. See, the trouble is they're only at 141. Do you know what I mean? So it's
because they never get up. But even with the sympathetic reinnervation, they don't get up to.
Not everybody does get sympathetic reinnervation. Okay. When it does occur, it's usually 5 years post. It's not in everybody. So, and some people may be on some medications that will blunt their heart rate. So it's a really hard
beta blockers
question to answer. But I can look at Dwight, and he is, and even Elmar a little bit. Both of them are getting some age-mediated heart rate reduction because now Elmar's 11, 12 years. He's not getting 180 like he said. He's 169. We had Dwight at 177. Now he's 151. So the answer is I don't know because that 141s, I can't say. But in these two individuals, they are, yes, getting the age-related reduction you just described. Believe it or not.
Why is this 141 magic number? What is that?
So that Claudio Marconi had a nice review, and he reviewed all the literature, sort of a systematic review. And in the 1,700 heart transplant recipients that he could find in the database, their peak heart rate for 1 minute was 141, and their peak VO2 was 21 mils per kg.
Wow.
It's just if I can mention something, because through my story, I met a lot of transplanted athletes and a lot of heart transplanted athletes. And what I see that if you have like heart transplant people which get the heart in younger age, and I'm not talking about in their 30s, I'm talking in 5 years old, 10 years old. Yeah. Oh. But these people, yeah, if they go to school, they start running around, and kids nowadays are sitting at home playing some PlayStation, whatever. But I'm talking about the kids running around back and forth. And if you look at their heart rates, they go up much more over 141. They have 160, 170. So if sometimes people send me questions, I always ask, how high is your heart rate? And I think they say, oh, it's 160, it's much too high. I say, no, you have to be lucky.
Yes.
It is 160 and it's not ending up 140. I always tell them, if you have a car and then you drive it you always go between 50 kilometers per hour and 80. The range is so small. And Dwight, in my case, the range is from, I don't know, from 20 to 200 or 180. It's big, wider range. And the problem is, if I talk to people, then they say, oh, if you have a heart rate 140, that can't be healthy. And I think, why? I mean, if the average heart transplant person is just going for a hike, yeah, if he's walking 6 hours, he has a heart rate 130. If I do an Ironman, I have 135. Why? So my heart, my body, no one is knowing that I'm doing an Ironman in that moment, or I just go for a hike. I mean, walking around is unhealthy, so it's just the heart is pumping 130, and in the other case also 130, but my heart is just has a wider range and it's better trained.
And you must have a big stroke volume as well. So your heart rate is, we're talking about the heart rate that you've got compared to other people, but the cardiac output is heart rate by the stroke volume. So how much you're pumping per beat. So you must be pumping more blood as well. Do we know how that's what's going on there, Mark? That some people, I guess, you said the heart can be stiff after the transplant. Do some people get more sort of, compliant hearts than others, or so that they can have higher stroke volumes?
So that's interesting. We've sort of, compliance is difficult to measure. Obviously, Ben does a lot of invasive work at the IEM. You can do some estimations, and when we do estimations, like Dwight and Elmar's hearts are a little stiffer. So the heart doesn't fill as well, yet theirs is more probably compliant than most heart transplant recipients. Plus, they probably, a lot of transplants maybe don't contract as well, also to eject blood out. So the preload's a little bit lower and the afterload is higher, although Dwight and Elmar's would be more favorable. But yeah, like Dwight's cardiac output, would be somewhere around, in his prime, 20 liters per minute roughly, whereas Elmar probably is around 25,
Okay. So I guess they're getting the normal sort of responses to endurance training in terms of increases in left ventricle volume and things like that. Is that?
Yeah, so they kind of would have, your typical maybe PE student, kind of the textbook 25, 20, 25. But remember, 42.3 is the highest ever reported for cardiac output. So it's still half of the elite athletes, but still much higher than the few studies that have measured cardiac output in transplant recipients. It's like 14 liters, 13 liters per minute. So theirs would be higher, but still not at the elite endurance athlete cardiac output,
Sure.
even though their heart rates might be the same. Just the stroke volume cannot get that high.
But they'll be getting the normal sort of response. So you know how you were saying
Yeah.
most heart rate, I keep saying heart transplant recipients, most of them don't exercise that much. But if they did, they would get the normal, I'm assuming, increases in left ventricle size and things like that, I guess. Or
Yeah.
is it, you said that they're just a bit less
It's
high. Do
hard
we
to
even know why that is? Do you know why?
It could be the ventricle is a little bit stiffer, could be related to the ischemic time, it could be related to rejection, donor recipient mismatch. Probably my belief is it's again when you're implanting the donor heart into the recipient body, you still have vascular failure. So it's like
Yeah, of
your
course.
hose is still tight. So as a result, that pumps well, especially in the body it was in, it had more compliant vasculature. Now it's going into a tighter vasculature, right? Because you still, again, if you're non-ischemic like Elmar and Dwight, your vasculature is more favorable than someone who's got ischemic disease, but they still had heart failure and their vasculature would be impaired. So now you've
Yes.
got this pump, but now you got to occlude your hose a little bit. So as a result, now that heart is loaded. So that will affect how it fills and it affects how it pumps. So that unfortunately will always be a factor.
Yeah, I guess it's like I was just working on my sprinkler system. And I
Yeah.
brought this up a few times in talks. So I guess if you've got like a tap that doesn't, you can't get much pressure out of it, and it's just delivering enough water to water your plants. Now suddenly you've got the tap's on more, but the sprinkler system, you haven't like altered the ends to make it produce more water. So I guess that's going to put your blood pressure up. So blood pressure got mentioned before as well. So I guess I wonder if we can just talk quickly about the anti-rejection drugs and the fact. So I guess these guys are still on these anti-rejection drugs, and what are the side effects, and whether exercise actually attenuates that? Because I guess if it is affecting your blood pressure, then exercise will help.
We did a study of exercise training of 12 weeks. I believe it was 12 or 16, and it was 5 days a week, like they do in rehab. And we looked at cardiac function, endothelial function, flow meter dilatation. It's okay measure. It's not exercise measure.
No.
And then lean mass. We improved VO2 in the exercise group. We didn't change vascular function. We measured cardiac function during submaximal exercise. It didn't improve. The only thing that really improved, and this was a continuous plus interval training, was the lean mass went up. So it would appear that the limited studies performed to date suggest that the adaptations with exercise training in heart transplant are peripherally mediated, probably greater lean mass, probably greater oxidative capacity utilization of oxygen in the muscles. But the few studies, again, don't seem to improve cardiac output or vascular function. So the skeletal muscle has a plasticity. Now, some of the immunosuppressive drugs early on as well, the prednisones, they cause muscle myopathy and wasting. So, and some of the medications can cause weight gain and hypertension and vascular dysfunction. So exercise definitely is going to be favorable because it hopefully attenuate these deleterious effects. But in our study, which I think was quite well done, I'm biased, obviously, we only actually improved VO2 through muscle adaptations. We made the muscles bigger and they probably utilized oxygen better.
Okay. So maybe there aren't.
We did not change cardiac function. We did not change vascular function.
So maybe there aren't really that much changes to left ventricle.
No, they're not.
Okay.
We're not getting the athletic heart, eccentric hypertrophy that you're going to see in an endurance trained athlete. But again, Elmar's heart is bigger than most heart transplant recipients, and it's more physiologic, but it's still well below a Tour de France heart.
Which is fair enough anyway, because he probably wasn't going to be a Tour de France.
Correct.
Anyway, right?
But he still is. But his heart, but I don't know now, right? But would his heart now be bigger than his own heart if he didn't have heart failure? Maybe because he's running faster.
Yeah,
Because
it's
his muscles
amazing.
would have been pretty conditioned before transplant when he was doing his Ironmans, right? So maybe.
So Dwight's maximum VO2 max was 58 or something. Is that the
Yeah,
highest?
his highest.
That's crazy.
Yeah, but he's 60 kilos, right?
Okay.
So his
Wow.
absolute is about 3.5. So Elmer's absolute's a bit higher, but he weighs more. Having said that, it's phenomenal. It's 3 times higher than all other transplant recipients when he was at his peak.
And I've read somewhere, are they saying that Elmar is the fittest heart transplant recipient currently in the world? Is that the feeling?
Well, I say that, but Dwight's here too. So it depends what phase you're at, right?
That's why I mentioned Dwight first, because
I would say Dwight's the fittest, longest living heart transplant recipient, even at his 26.4 now. But because when they're both at their peak for VO2, they have the same score.
Oh, about 58 or something.
But because Elmer had done the Ironmans before, his times are a bit faster. But we have to see when Elmer's 18 years post what he does the Ironman. But it may be a bit quicker than Dwight because of his pre-Ironman training. But it's so hard to compare. So I would say take it together. If we put their VO2s across the day 1 to day 4, year 40, these two are the fittest ever. And at one point in time, each one is the fittest, if that makes any sense.
Exactly. Which
because
is
because Dwight was 2 decades when he did it. Ironman. Elmer was 3 years post.
Wow. Okay. Now, is there anything, my wife actually suggested this. She said, make sure it's relatable to people that don't have heart transplants. And I said, well, I think it's a bit hard. But one thing she said is there anything that we've learned from heart transplant recipients that is applicable to, I guess, the importance of exercise, right? I mean, that's...
It's the exercise is the key to longevity, right? And every population epidemiological study, those who are fitter live longer. And I mean, look at Elmer and Dwight. They're living proof of that. I think what's the unique thing though is that we never expected is the nerves growing back. Right? We never expected that. So now biological pathways, no clue. I have no clue.
It's amazing.
But I guess what we always say is that what's the take-home message? It's never too late. We've had people who've had a cardiac arrest, Elmer 2 or 3 times. He was on ECMO. He was on LVAD and RVAD, 170 days of bed rest. Like he should not be alive, and he's still moving. And same with Dwight. He's now 4 decades. I can't say it over. He's one of the longest living heart transplant recipients, and he's because he moves.
Yes. Wow. Okay. So
Can I step in?
Absolutely.
I think my own experience has been that if I'm not exercising, and maybe this is just typical of heart transplant patients, but if I'm not doing something active, then I literally feel immediately that I digress in terms of my fitness levels, and I feel poorly. It's only when I get up and start moving and start exercising that I actually feel good. And when I stop, then I feel bad, terrible. So
can I ask? So once you have a heart transplant, so obviously people are dying on average 13. Is it? You said 13 years,
roughly.
Well, if you make the first year, is it? And then 13. So that makes you think. Okay, so once you have the new heart, you aren't, kind of back to normal. Obviously, you've got the anti-rejection drugs, but what I'm trying to think is if you're exercising and you're doing the right thing and eating well and all that with the new heart, are you sort of back to normal, or is it always going to be?
So that's really interesting. And what we've said is, like, because a lot of heart transplant recipients, their fitness was low to begin with, and then they had this sort of 14 mils, and then they get above that post-transplant, they've kind of gone back to what their normal was. Do you know what I mean? As far as VO2. Dwight and Elmer had very high VO2s probably before. Elmer for sure, because he had some VO2s. Then they had this decrease, and then bed rest and transplant, getting back. They've both now gone to their old new normal. So it's just yes, you go back to your normal, whatever your normal was before your heart failure. So for most, it's like 20 mils per kg.
Yeah.
But Elmar and Dwight have gone back to their normal, which is at their peak 58.
Okay.
So, and there is a legacy effect of there has to be a legacy effect. I can't necessarily say your heart because it's an allograft, but there's a legacy effect for the vasculature, the skeletal muscles, mitochondria, capillarity for your pre-training that all those years you packed in. There is some legacy effect because Elmar and Dwight and a few others have gotten back to their very high level posts. So there is some, I think, legacy effect. I don't know what that even means, but there is something about getting back to their old normal that they do get back.
And once you get like, so Elmar's 37 and a half years, is he, sorry, Dwight and Elmar's 12. Is his prognosis the same as everybody else now? Or is he still at greater risk? We don't know.
You know what? We even just stopped talking about that because they always go in sort of 5-year aliquots. What do you say to a Dwight who's at year 40?
It's
you've outlived technically 3 statistics of 13.
Okay. What about, I kind of feel bad. I thought about bringing it up. I thought maybe I shouldn't, but obviously Elmar's at 12, right? And you've said 13 is so, but because he's exercising, is the assumption that he will just keep going? You know, it's not like, oh, you're at 13, that's it. Like, because he's been exercising, eating well, or do we not know enough about that?
There's not enough people who have had this. I'll give you an example. This is kind of classic and it's a personal. So my sister-in-law has had a heart double lung transplant. She had something called primary pulmonary hypertension. So 1 in a million are diagnosed with this. She won the lottery, unfortunately, and she required a heart double lung. She's now 32 years post heart double lung, and I would call her sedentary to active. So I have to be cautious here now because she's almost lived as long as Dwight, but never have done anything Dwight. So it comes back to like there must have been a good match, low ischemic time, great donor as far as matching. Do you know what I mean? So I could say yes, unequivocally, Glenn, you're right. But then how do I then say, but I've got a sister-in-law whose VO2 is probably 15, 16, and she's lived that long. So
the common denominator is that they all know you. You're the one that makes them.
Yeah, that's funny. Actually, that's good. That's scary. Common denominators would probably all outlive me, but
okay.
You know, so it's so hard to answer because again, it's like the ischemic time, and it's just like Dwight always tells me too. There's more than the physiology, Mark. There's more just than physiology to this story.
Well, I know Dwight emailed me separately and said about spiritual things and all that. Did you want to talk a bit about that, Dwight?
Sure. I guess just to recap in terms of my own journey, both spiritual as physical, is that I understand that we don't control everything. I believe there's a creator. I believe that he has a plan and a purpose for each person. And it depends on whether you want to accept that or not and where you go with that. So Mark knows me, and I've shared these things with him as well. And there are just things in my life that led me to the point of a transplant, and then subsequently that I can't believe was just fate or chance or coincidence. I'd have to have more faith to believe that than to believe that there's a God and a Jesus Christ that has helped me through all this throughout my life, and whom I have put my trust in. And so that's where, even when I was first transplanted, the clinic said, you know, it's interesting that you have this spiritual sense, because we have found that people who have a faith, quote, faith, whatever you want to define that as, live longer and actually do better with transplant than those who don't. And I don't know where they got their study from. But I found that sometimes when I get to a point where I think I can't go on anymore, like 5 years ago, I thought that was it. I was told again that you likely you're going to need another transplant in a year. And that's it for you. And And then, as I mentioned in my email to you, Glenn, I said that 3 months ago, I had this experience and I just knew that something in the heart had changed. And then that was corroborated and proven by subsequent VO2 tests. And we can't explain it. And all I can say is, well, God must still want me here for a purpose. There's a design to life. And like Solomon said, there's a time to be born and a time to die. And it's been determined that it's not my time yet. So that's kind of where I'm coming from.
Well, you've definitely, you've definitely had an amazing effect on these people, Mark and Elmar. I guess I don't know how to follow that up, but basically, it's amazing that that Elmar, did you say that you Googled heart transplant and exercise, and Dwight came up? So you said, and that you wouldn't be probably where you are without Dwight.
Yeah, I think I found either Dwight directly or Ken, so the student of Mark, and then we get in contact. And yeah, and the good thing to knowing Mark over the years, and I visited him and his family. I got the chance to come to Edmonton, and then I met Dwight in person, and that was that was really nice.
So I got a really crazy story, Glenn, and this is sort of bizarre. So for the Ironman Canada, you either qualify or you can, the day after the race, you sign up. So the year that Dwight did the race, he had to sign up the year before. Okay.
Mm-hmm.
The year he signed up, Elmar ran the Ironman Canada with his own heart. Now, don't tell me that is so freaky and bizarre that these two are here today, but one ran the race with his own heart, and Dwight the next day signed up. And
so I was definitely there in Penticton when,
like, that's so weird.
But I was there after the race because we stayed there for another 2 days. That's crazy.
Like, who would ever think that then Elmar in the future is going to have a cardiac arrest and require a transplant, do an Ironman, and Dwight did the Ironman that it's bizarre. But anyways, that's probably not related to anything, but it's just kind of weird.
All right. So how do we wrap this up? So we've sort of wrapped it up as we've gone along as well. What I'd like to say at the end is have some takeaway messages. I don't know, maybe each all three of you can have a takeaway message. So maybe Mark, what's your takeaway message from the chat and the whole thing?
For me, it's just what I've learned from Elmar and Dwight. It's just never too late to exercise, and you could be a physiologist, but they're also my friends. And they've also really I like to sort of live the life they're living as far as fitness, and I look to them and think, good God, I think of Dwight all the time, and I got to get on the bike behind me because he's correct. I preach this, I publish it, and some days I don't do the things that I should be doing, but it's never too late to exercise. And I just think they're remarkable, phenomenal, phenomenal human beings. Yeah.
Dwight?
Yeah, what I'd like to close with saying is that for me, it's this whole life journey is about relationship with people. And the day that Mark called me triggered a series of events for the next, how many years? 20 years of motivation. I love research. I love science. I love knowing why things work the way they do. And Mark brought that to me, along with Dr. Ken Reese, who is my coach and trainer as well. And then, of course, there's the transplant team here at the University of Alberta that I think they've wanted to take me out to the woodshed a couple times. And the old saying, take you behind the woodshed and beat you, because sometimes I don't exactly listen and do everything that they tell me to do. but I certainly appreciated the years of help they've given me, and their desire to keep me alive as well. And so, you know, there's so many factors, so many people that have gone into bringing me to this point in my life where I've been able to experience time with my wife. I was told we wouldn't have kids. We have 3 boys and 3 grandchildren. And all I was looking at when I was transplanted was, Lord, just give me enough time to see my kids grow up and be on their own and surpass that.
It's another generation.
Yeah. Yeah.
When I stumbled around before saying, you know, I didn't know what to say after you said what you said, what I meant to say was, I guess your faith and your willpower and everything is what brought you guys together. Because if you hadn't pushed, then Dwight would never have found you, and then Mark wouldn't have found you 18 years later and things. Yeah, is that fair to say?
Yeah. So I owe a world of gratitude and thanks to those people.
Right. Elmar?
Yeah, what Dwight said, relationship is one point, but I think even if times are really, really bad, you are not in a good situation anymore, but always stay positive. Yeah, that's really important for me. Having dreams, setting goals, short, mid, long term targets. I think that's all about, and to see things positive. If I could every day sit and look back and said, why me and whatever, but if I see the positive things, how many nice people like Dwight, Mark and family and a lot of other people I could mention now I've met throughout my story, and what I experienced with the new heart. I mean, that's in the 12 years, I think that's packed full what other people maybe have not in 70, 80 years. Yeah. So I don't know. Sometimes it's crazy. Yeah. I have to like to do this like to myself because and the good thing and the last thing is that what I try to do is I'm not really thinking every day that I'm heart transplant. I take my medication. Now I'm traveling again, so I pack my stuff. So I'm sitting here. But today my physio was here. I have some muscle issues, and I always think about what's wrong with my tire on my bike or what's my calf to my muscle. So I'm not thinking about that. I'm just try to focus on things I love, and sport is one. And
Is that the same with you, Dwight? You were nodding there that
Oh yeah, absolutely. Like it over time you really actually forget that you're a heart transplant. And one of my doctors said, you know, actually it was Eileen Burton, who was the coordinator for many years with the transplant team, and she said, you know, just the best testimony or the best example you can lead is to live a normal life. Live a life as if you're not a transplant. And that spoke to me. And yeah, just like Elmar, you don't think about it. You don't go, you know, initially you might go to bed thinking, am I going to get up tomorrow? Am I going to wake up tomorrow? Next time I get on the bike, next time I get in the pool, am I going to actually come out of the pool? Am I going to be able to get off the bike? When I go for a run, am I going to come back? You don't think about that anymore because you just believe, you just have that faith that, yeah, it's functioning the way it should, and I don't have to worry about it.
Yeah, and it actually reminds me of, because often we used to say, we've got a diabetic coming in. You say, no, it's a person with diabetes. We've got an asthmatic coming in. No, it's a person with asthma. You know, you're a human being. You're not just a walking replacement heart. You know, there's so much more to you than that.
Yeah, and I will, when I go out and I play sports, I don't go with the intent of advertising that I had a heart transplant. I want to be more accepted as part of that community without
Who you are.
perceived disability, right? I just want to be normal. I want to do what everybody else does. And then when they hear, of course, oh, well, you had a heart transplant, then sometimes those relationships change a little bit.
Ah, wow. Well, you guys didn't go back to normal, though. You went way beyond that in terms of physical. So it's amazing. All right. So thank you very much for coming on. It's been really amazing. And it's actually motivated. You know, you talk about motivating Mark. I used to be a distance runner and I always get injured and, oh, poor me. So now I just ride bikes and whatever. It's like, dude, just go back and get yourself sorted. Because I always say, cycling's fine, but if I can run, I just throw the bike on the road. Just fucking run over it. I don't care. You know, running's my thing. So I'm motivated. Just get back to try running again. So you've motivated me.
Well,
you
Mark,
got to beat their VO2.
Mark has agreed to do a 5K with me in May.
Yeah.
This is a challenge for me.
I've already started training, so you look out.
Well, guess what? Hold me to it. I'm going to do a 5K in May as well. There you go.
Right.
I don't even run at the moment. Okay. Well, thank you very much, guys. It's been really, really a special one for me. So thanks for coming on.
Bye.
Bye-bye.
Thanks, Glenn.
I hope you enjoyed this podcast. Please like, subscribe, pass it on to your friends and colleagues. Check out the other podcasts. Thanks again.